Hi guys, I am here in Dunwoody. I'm actually meeting my brother and an aunt who's here from Pennsylvania to watch the Steeler game. Go Steelers. Yes, I am a Steeler fan. A serious fan too. So let's check out Gillies. So this is my first time here. I've never been here before. So let's hang out. Let's see how it is to watch the game here. My brother and my aunt should be here. I was actually supposed to ride with my brother, but typical me, I'm late, so I had to catch a lift here, and so I actually beat him. So we'll see. Anyway, go black and gold all day, every day. Good morning, guys. I'm going to insert a clip right here so that you can see a picture of us at the sports bar called Gillies. And then your dog barks. So today I'm going to take you guys with me, for real this time, to my pre-op appointment. So you're probably saying, oh my gosh, pre-op appointment, Jennifer. What sort of a procedure are you having? So I am having my gallbladder removed, my tubes removed, and a cyst from my ovary removed. So today I'm having a pre-op appointment with an oncologist who's going to be performing the surgery concerning my reproductive organs. They do not think that it is anything related to cancer. I was referred to this physician simply because she is an oncologist and frankly a better surgeon than my OBGYN. Out of her own mouth, she said, I'm going to send you over to her. So I'm going to do my pre-op today, and in just a few days I'm going to be doing my surgery. So I'm going to tell you guys about how I feel nervous, which I do, how I'm leaving it in God's hands, but just want to walk you through it. Whenever I went on YouTube and I did research to try to find out what to expect after a gallbladder surgery, or what to expect after your tubes are removed, or you have a cyst on your ovary that's removed, I didn't find much information. So I want to share my story with you guys. Hopefully anyone who's watching, if you're going through this too, you can send me any questions to my inbox. One thing that's a little bit concerning for me is that, as you know, baby Gabe, as I call him, is 9 months old. But when I had him, I had a C-section and there were adhesions in my stomach. So usually when you have a C-section, they remove your uterus, they inspect your uterus, and then they actually insert it back into your cavity. And of course, they're going to stitch it up and do everything they need to do. But whenever I had my C-section, they were unable to do that. So that made my OBGYN a little more concerned about performing any surgery. So then the question was, well, do you have endometriosis? Why did you have adhesions in your abdomen? So that could complicate things, but glory to God, it's not going to complicate things for me. I'm praying for a smooth surgery. I have 2 surgeons who are going to be working on me later this week. But again, taking you all along with me, just to wrap up what we talked about whenever we were Black Friday shopping. I told you guys that I was going to be making a wreath. I did not, but my beautiful mother-in-law did. So let's take a look at that. Look at that, guys. Isn't she a beauty? Very nice, half the price. Okay, I'm gonna head out to the car. I'll see you guys soon. Okay guys, I made it here. I'm walking in now.
Documents, just because I've prepared everything, just make sure, for you to verify and make sure that I spelled your name correctly, and that is your correct date of birth information. So this is the consent form. We'll sign it at the end, but what it says is that you, patient Jennifer, okay, what she's gonna do is a laparoscopic robotic right ovarian cystectomy versus an oophorectomy. So the plan is to do a cystectomy, but she might possibly have to take out the whole entire ovary.
Okay.
So that's why it says cystectomy versus oophorectomy, and a possible bilateral salpingo-oophorectomy. So depending on what she sees when she puts the camera inside, she might have to take the other one as well.
Okay.
Okay, did you guys talk about that?
We did not, but that is fine.
Okay.
Based on what I have set up, that would be okay.
Okay. And a possible appendectomy, because the appendix is on the right.
Yeah, we did talk about
The cyst is on
that.
the right, and if, you know, just sometimes by direct extension, stuff from the right ovary can kind of get into the appendix, and she might have to take it out.
Right, yeah.
And at the same time, she's going to be doing the surgery, which is going to take out your gallbladder. Okay, but you'll sign a separate.
Right?
I know, but you'll sign a separate consent for the gallbladder.
Okay.
Because he'll be doing that. Not gallbladder. He'll do the gallbladder.
Okay.
Okay. So does that sound like what you guys talked about?
Yeah. We did talk about removing my tubes also.
And that's what an salpingo means. Okay. So that's sort of a possibility. In all likelihood, if she removes the right ovary, she's going to take the right tube as well.
Okay.
It's just a possibility that she might have to take the left, but that's not the plan. But she wants to make sure that when she looks inside, if anything looks funny,
take it out.
Yep. And then so she would take she would take if she had to take the left ovary, she's going to take the left fallopian tube, because she's not going to leave. There's no reason to leave the tubes in.
Right.
Okay?
I kind of want the tubes out anyway. We kind of talked about that. So.
Okay. That is her plan. Okay. All right. So we'll sign this at the end. So, and I know, there's a lot. There's, the gallbladder, the possible appendectomy, the possible removal of both tubes and ovaries. But then her main plan is, if she looks inside and everything is as she hopes it to be, then it would just be just the cyst on the ovary. But if it looks funny, she's going to have to take the ovary and the tube. Okay?
That's fine. Yeah.
Okay. All right. So after you leave here, I'm going to send you to pre-testing. So anytime you're having surgery at Northside, or really any hospital, you come for your pre-op with the surgeon, and then you go to pre-testing, which is where anesthesia clears you for the surgery. Okay. The anesthesia and doctor are basically looking for most of the same things. Okay. They both require some blood work to be done within usually about a week prior to the surgery. Your surgery is scheduled for this Friday, so we're within that time frame. So you're going to go to pre-testing. They're going to draw some blood and ask you some questions, discuss your medications with you. Okay. They're going to do a CBC, which is complete blood count. We're going to check your platelets, your white cells, your red cells, make sure everything is good and normal. They're going to do a metabolic panel, which checks your kidney function, your liver function, and then also your electrolyte levels to make sure your potassium, sodium, and calcium levels are all normal. They're going to collect some urine. Doctor isn't really anesthesia that wants urine. Doctors to do a UA with culture on everybody, because a lot of times women have some bacteria in their bladder. We're asymptomatic. We don't know it. But if you do, then we start you on a course of antibiotics. It doesn't delay surgery or anything like that. It's just she would rather us to treat anything unknown ahead of time, so that after you have surgery, you're not in pain or having a infection that's getting worse that we were unaware of prior to the surgery. Okay. They're going to do a pregnancy test. Okay, and they're going to do it because we do that for all the premenopausal women. It's a requirement of the hospital. And then a type-in screen, which is where they'll draw a little tube of blood and send it to the blood bank, and the blood bank will type and cross and have just 2 units of blood on hand and available the morning of surgery, just in case. It's not, Dr. Cheney doesn't expect to need it, but she likes to be prepared like that. Okay. This says EKG and chest X-ray. That's per anesthesia. If they want or require those, they will do it while you're there for your pre-testing visit. But it's unlikely that they're gonna. You don't have a history of anything like that, so you have no history to be concerned about. So this is just their order set to know what the nurse needs to draw when you go there. Okay. This sheet is just a form that we have all of our patients, or Northside have asked us to have all of our patients sign who are having surgery. It basically, by signing it, you're authorizing Northside to bill your insurance for the procedure. Okay. See, it's how it says, please submit a claim to my health plan after I receive the services. It's by signing it, you're basically giving authorization to Northside to bill your insurance. So if you don't mind to sign in date and time, and then I will sign as a witness that I watched you to sign it. And today's the 27th, and it's 10:08.
I'm very nervous. Oh.
I know. I had surgery at Northside about a year ago. I had never had any surgery, and I was very, very nervous. But anesthesiology here is excellent. Dr. Tenney is a phenomenal surgeon. She's not going to do anything that doesn't need to be done.
I know it, yeah.
She's very conservative in that way.
Okay, the thing I think I'm most worried about, though, is that she was saying that my OB who sent me to her, who didn't want to do my surgery, said that doctor surgeon, and so she sent me here. But they are concerned that I may have endometriosis, and so that worries me. It's like, okay, what if they get in there and something goes bad, you know?
Well, endometriosis definitely kind of is one of those things that make it more difficult because you might have more adhesions, and that's why Dr. Tenney is like, this is the plan, but I gotta look and see. Because if the other ovary has a ton of endometriosis, and it could, endometriosis over time can cause problems because of what happens every month and just ongoing, destruction that it does inside of here. So that's why she wants to have that option if she needs to take the other ovary. But I will also say this, Dr. Leach, she has a lot of experience with surgery on endometriosis patients.
That's what I wanted to know.
And she really does. And she's very, very careful, very cautious, but she's really good at doing surgery with endometriosis. A lot of surgeons aren't comfortable with it. They haven't had as much exposure to it, but she has had a lot of training with that, and she's very, very good. And even if there are areas of endometriosis or she sees adhesions, she's going to be very careful about how she manages it, but she also wants to make sure she could get as much of it out as possible.
Yeah, okay.
Because you don't want it to
continue.
Exactly.
Yeah. And
I know it can be hard to because it can get a lot worse over time.
Yeah.
You haven't had other surgery on your pelvis?
I had a cesarean section. That's when it was really evident that something wasn't right because they couldn't remove my uterus when they were doing the C-section.
Because it was stuck.
Yeah.
Okay. Alrighty. This is just your instructions for the day of surgery. Okay. And what this tells us is the date, the time, and the time of check-in. So your surgery is scheduled for this Friday, the 30th of November at 3:15 in the afternoon. Is that what Robin told you? Okay, good. With 1:15 check-in, so you check in 2 hours early. It's going to happen in the 1800 building here at Forsyth. So, Northside.
All right, guys, I've had all my testing done. I am headed back to get my car. It's kind of funny walking through the hospital today. Usually when I'm at a hospital, it's for work and I'm working and I'm not a patient, but today is a little different. But I'll talk to you guys soon. Catch you up on what's happening. Hey guys, I am back in my car. I just wanted to come to you really quickly to say that when I get home, I will look at all the paperwork with you guys and we can talk about exactly what I'm having. I feel a lot better now that I talked to the nurse. I know that they have taken great preparations in preparing for my surgery. I'm thankful to my OB for sending me to my surgeon who is skilled in endometriosis, even though, they're not sure if that's what I have. They are sure I have adhesions, but could possibly have my tubes and both ovaries removed, as well as possibly my appendix. So I had to sign all that paperwork. Talk about why I feel so comfortable signing that paperwork. I do have a son. My husband and I do want to have more children, but more to come on that. What else can I tell you guys? I just feel so much better now. I was very nervous going in. I trust my OBGYN. She is a phenomenal physician. And I know she was sending me to someone who she felt was a good surgeon, but I didn't realize the extent of training that doctors went through concerning endometriosis. And it's great that I'm also going to have a general surgeon there who's going to be taking my gallbladder out, who, if they run into anything, they will both be there. They're both very skilled at what they do. Another thing, I mean, I have to be honest, y'all are my family, right? So I have to tell you the truth. And I'm trying to use this mount that's not really cooperating with me, but anyway. So I'm having the procedure done at Northside Hospital, which is not a big deal. It's a great facility. And I actually had my son at Northside Hospital, Atlanta. This Northside Hospital, however, is the Forsyth location. So we are in Cumming, Georgia. If you're not from Atlanta or you don't live in Atlanta, that may seem like a very small thing to you. But if you just Google Forsyth County Oprah Winfrey on YouTube, you'll see why it was a bit concerning for me. Even in this day and age, 2018, this is not an area that I frequent. I don't have a reason to come here, but it just so happened that when I was getting my gallbladder out, the physician who my GI doctor recommended me to, because I had some issues while I was pregnant with my gallbladder, he recommended me to doctor who is going to be taking out my gallbladder, and he only does surgeries here at Northside Forsyth, okay? So then I went on a work trip where I was speaking at a user group meeting for our customers. And I had another medical issue where I actually was late to that conference, almost missed my time to speak, but I did make it, came back, went to my OBGYN, and then she determined that I would need to have surgery to remove the cyst from my ovary. And she sent me to doctor who just so happened to perform surgeries at Northside Forsyth as well as Northside Atlanta. So because she doesn't do gallbladder surgery, I decided to still come to the Forsyth location. And after being here today, having my pre-service treatment, so blood and urine analysis, they need to check to see what blood type I am so they can have blood on hand in case they would need it, since we're having an extensive surgery, or what could be an extensive surgery for the reproductive organs. Yeah, so after being here today, I do feel a lot better. It's just about like the unknown. Like, whenever you think about like being fearful of something, usually it's something that is unknown. It's the unknown that you're frightened about. So I'm just trying to, reassure myself and just know that God has me in the palm of his hands, and that he's going to take care of me and see me through this. But it's just a little bit different. Being in a hospital and not being there to just do a surgery. I'm sorry, I was distracted from beeping. Not being there. Who are they beeping at? They're not beeping at me. But not being at a hospital to work, right? Not going into a meeting or to do an observation, but actually going there to have a surgery is totally different, right? And I don't like surgeries. So I think I don't like surgeries because when I was 13, if you know me, you know this. But if you know me just from YouTube, you don't know this. So I'll tell you. But when I was 13 years old, I lost my mother. There's a long story as to how all of that came forth, but long story short, my mother went in to have a surgery and she never came home. So it's kind of a sensitive thing anytime I have to go under. So like, I'm always worried about surgeries just in general. I think it's just because of my experience as a person. So anyway, with that being said, when I had my son, I didn't have a chance to get nervous about the C-section. It was like, hey, it was an emergency C-section. Let's go right now. I was like, oh, I don't know if I want to do this. I'm scared. Like, my husband's like, get it together. We're going. They're taking us back. So that was totally different. This is something that's planned. And actually, I had the gallbladder surgery planned for like 2 weeks ago. I should have had it. But after I went on my work trip and had another issue with my ovaries, then they decided, well, you're going in. You need to have it done all at once. Why go under, come back out, and go under again? Well, I'm all for that. So, yeah, I'm just ready to go. So I will keep you guys posted on what happens. Today is Tuesday, and I will be back here on Friday to have the actual procedure. As you heard, I think I may include that when I recorded the nurse that I wasn't supposed to record. I didn't ask, but I did record it just for my vlog. But yeah, I think I'm going to have to stay overnight at this hospital. So we'll see how that goes. Hopefully they go in, they get exactly what they need out. There's not a lot of adhesions. But as you heard her mention, with endometriosis or adhesions and scar tissue in your abdomen, it can cause an issue in the future. It has been painful so far for me right now, but nothing that is unbearable, nothing that would require me to take narcotics or any sort of real medication that's not over the counter. Ibuprofen. I do take the ibuprofen 800 that I had from my C-section, and I mean, I had him 9 months ago. I've never got a refill, so that just tells you how often I take that too. But yeah, so hopefully they can clean everything out. We have a great procedure, and I also want to come back. I think maybe tomorrow I'll do a chit chat with you guys to talk about my gallbladder issues that I had during my pregnancy. Still today I have to sleep sitting up so that I don't have another gallbladder attack, and we can talk about gallbladder attacks, and I'll be continuing this journey after my surgery to show you how my eating may change or may remain the same, or any symptoms that you may encounter if you're having this surgery. Again, if you guys have any questions, you can comment down below and I will get back to you as soon as I can. Thanks for watching. Bye.